Good morning, Dr. Desmond White. I want to talk about side effect of proton pump inhibitors. As a gastroenterologist, we often prescribe proton pump inhibitors such as what we call PPI, such as omeprazole, briprazole, most of these medicine to people with peptic ulcer disease, gastritis, dyspepsia, or gastroesophageal reflux disease. So we often give this medicine to patients. And as you know, every medicine that you look at the box, there may be a warning saying that it's a poison. In fact, every medicine we give to the patient that treat one problem may sometimes give rise to another problem or other problems. So there's actually no medicine that we dare say is 100% safe. They may, I say may, not will, they may be associated with some adverse effects. So for proton pump inhibitor or PPI, like the gastric medicine, there's a whole list of common recognized adverse effects or side effects that you as a patient, me as a doctor ought to know. We also have to understand that there's some principle behind it. The number one problem that we have is that when we take a long-term PPI, when we drop the gastric acid production, of course, acid-related problem like reflux or gastritis will heal. But we don't have enough acid in the stomach, there may be some consequences. Number one is increased risk of infection in the small and the large intestine. We postulate that is because when we drop the gastric acid, we may kill less bacteria that we swallow. When we change the pH, the acidity of the small and large intestine, we may promote growth of certain bacteria or certain viruses. So for people taking acid suppressant, they may be at a high risk of infection in the small and the large intestine. Some studies also suggest that they may have a high risk of chest infection as well. Other than that is vitamin or mineral insufficiency. We actually need gastric acid to help us absorb mineral like calcium and magnesium, vitamins like iron and B12. So but our body has sufficient stock and store for these mineral and vitamins. Yet if we suppress the gastric acid for more than a year, our stock may run out and they may show insufficiency. So most experts will say if you're taking acid medicine for say more than 1 year continuously, you should monitor the level of calcium, magnesium, iron and B12 because they may run out of stock and they may show some deficiency. I must say I've treated patients with PPI, I would say thousands of them over the years. I hardly give people more than 1 year supply of the medication. So the risk of such a number of patients with long-term PPI, more than a year usage, continuous usage is small. And among this small group, I do monitor all this level on a regular basis. And actually, I pick up very few numbers. So I think the risk is there for long-term usage, but the number of patients at risk is small and the actual number of harm that we pick up are extremely small. Other than that, some studies show that using acid suppressant or PPI may trigger an allergic reaction in the kidney. They may have some kidney issues. There's also other whole long list of unproven associated with PPI. That is, one is heart attack, number two is dementia. We can't really prove that because there's no good long-term data. So to sum up, the common side effect of a PPI long-term usage will be they have a mineral or vitamin deficiency. If you use for long-term continuously, they have a high risk of infection in the chest and the digestive tract. Some unproven association like heart attack and dementia are hard to prove. Okay, yeah. So just to sum up, I think PPI is a safe medicine. As a general rule, if we don't need to use it, don't use it. If we can cut back. If we can use it, we try to use it as the shortest possible limit. And we have sufficient store of all the vitamin mineral that we are worried that they will run out, like calcium, magnesium, B12 and iron. But if you're on long-term PPI for more than a year continuously, do discuss with your doctor, and they may want to cut back on the medicine. They may want to check the level of this mineral and vitamin. They may need to give you a supplement if necessary. I hope it helped. Dr. Desmond White.